Hello, and welcome to this informative presentation for parents about adolescent suicide awareness and prevention. We'll begin with defining suicide. Suicide is the intentional taking of one's own life, and many factors can contribute to this decision, but they fall into these basic categories of psychological, social, and biological factors. And some common characteristics that are associated with suicide are a belief that things won't change, that there is this idea that things won't get better. There's also just intense psychological pain and a desire to have that gone, to escape it. And then another characteristic are feelings of hopeless and worthlessness. And this is not to be confused with sadness, that sadness is a normal emotion that we all feel, and even some forms of hopelessness people can feel. But this is a deeper despair that there is no hope and that everything about their life is worthless. And they also have trouble making progress towards goals. So what are the statistics? The statistics concerning suicide among adolescents is that suicide is the third leading cause of death among young people ages 15 to 24, and it's the second leading cause of death among college students. Now, 5,000 to 6,000 adolescents take their lives each year, and 500,000 make unsuccessful attempts. That means that almost for every one person, or every person that has committed a suicide, there's at least 150 attempts, 50 to 150 attempts that are made for every adolescent that has successfully completed suicide. And girls tend to attempt suicide more often than boys. However, boys tend to be more successful because they use more lethal methods. Girls tend to use methods such as overdose and overindulgence in alcohol to the point of death or something of that nature, or a cocktail of the two. And boys tend to use more lethal items like a gun or some sort of noose. And this is very sad statistics, but these are some of the statistics surrounding suicide in adolescents. So we talked earlier about how some of the factors that contribute towards committing suicide are social. And so the question is, can social media be a factor in your adolescent's life that can contribute towards these thoughts of suicide and the actions of suicide? And although teenagers love social media, it can be a very, very toxic place emotionally and mentally for them, because they lack the emotional and mental maturity to handle it. And most times they are comparing themselves to people who are in different phases of life than them, in different walks of life than them. And it can be just hard to deal with feeling valuable, feeling worthy, and like your life has meaning when you're comparing it to the highlight reel of someone else's life. And a lot of things on social media are fictitious, but they present as facts. So yes, social media can be a factor. Social media is not an evil on its own. However, it does have influence on young minds and can steer them in the wrong thought patterns concerning themselves and life, which can ultimately lead to more dissatisfaction. And just if your adolescent is already facing some emotional or psychological or biological dispositions, could be a pretty toxic place for them. Now, here are some risk factors for adolescents. They're categorized by biological, psychological, sociocultural, and social. The biological risk factors are low serotonin, sleep difficulties, and chronic illness or disability. especially chronic illness and disability, because having constant issues that won't go away in your body um, can fill you with much despair. And that, remember that idea that things won't get better, things won't change. That is a very real feeling with chronic illness and disability. Psychological risk factors are childhood abuse, mental illness, hopelessness, and prior attempts towards suicide. Some sociocultural risk factors are cultural alienation, so feeling like you don't belong, access to firearms, and suicide contagion. Social factors are isolation, relationship conflict, and bullying. We all are familiar, or we could be familiar with bullying as a push towards just psychological distress. That social aspect is a big part for adolescents, because that those interactions can just be so they can feel very large to them in their life, and by all standards they are large because of the place that they are in life. Now, here are some warning signs, parents, that you can look out for, and that you should be cautious about concerning suicide in your adolescence. If you notice any of these signs, and even some that are not listed here, but if you notice signs, these are things that you should know as a warning. Depression, isolation, if they're isolating themselves, if they have low self-esteem, if they're dealing with lots of anxiety, if you notice apathy, that they don't care about anything or anybody or their own lives, and they stop, maybe they were once acting a certain way and had a certain attitude towards life, and then it has completely diminished and they've become very nonchalant. And, there are things that happen with teenagers, just teenagering, but apathy is a different type of sign to notice. Insomnia, if they can't sleep, you have to know they're under some sort of stress, psychological stress or emotional stress. And prolonged emotional distress. So, it's one thing to be sad. Sadness is a normal range of emotion, but, and it's even possible to be sad for an extended period of time. But when that sadness is prolonged beyond what is normal, and beyond, and it starts to interfere with life, that is a clear warning sign to pay attention to. Here's some helpful knowledge. If your adolescent has experienced any kind of post-traumatic stress disorder, it's safe to say that you should be paying attention to how they are. After a traumatic event, you have to expect that there's going to be a high level of distress. And this despair can lead to suicidal ideation, which is just like thoughts of suicide and these ideas and planning suicide attempts. So you want to make sure that, you're looking out for that and that you're heavily involved if your adolescent unfortunately experiences some sort of traumatic event. Most adolescents show signs of suicide and have an underlying desire, wanting to live, though. Most adolescents want to live, but they don't know how to live in the pain that they feel. And adolescence and young adulthood are often periods of confusion, emotion, identity formation, and questioning. So it's a difficult and turbulent time, and suicide may seem to be a logical response to the pain and stress of growing up. So it's good to be aware of that, so that you know how to come towards your adolescent to help them. Now, what should you do? I know with all of these factors and things that we're bringing up, you can feel sort of powerless to your child's emotions and to what they're dealing with. But there are things that you can do. Number one, don't be passive. If you think that something is wrong, ask questions. Number two, restrict harm-inducing substances. So if there's something that potentially they can use to harm themselves, remove it from being in their midst. Like, just remove it from their reach. if that be a weapon or any kind of substance, pills or anything of that nature. If you've noticed signs and you're really concerned about your adolescent, just remove the things that could possibly hurt them. Number 3, therapy. Find a quality therapist or psychologist that can help. You don't have to do things alone. You can build a team, a community to care for your child. Pay attention. Keep a watchful eye and take notice of increased or decreased behaviors and performance. That's a way that you can sometimes get ahead of what is going on. Number 5, seek help. Like I said, you do not have to do things alone. Talk to family, trusted family members, trusted friends, trusted community, and professionals to help you in the best interest of your child. And number 6, talk. Don't underestimate the importance of opening the lines of communication with your child. Being able to have conversations about how they feel without judgment, without any type of assumption, but just them being able to feel safe enough to express themselves is an important part of what you can do. Here are some preventative solutions. More of what you can do. Be bold. Remember, I just said about having discussions about how and if a person plans to take their life can be a deterrent towards them taking their life. Have conversations openly without judgment. That's a big part, without judgment, so they won't clam up and not tell you what's really going on with you for fear of disappointing you. I would say not to express disappointment towards how they feel, because that's just how they feel, and you have to make sure that you are a safe place for them to feel and for them to express what's going on, because you want to know. You can be proactive. Don't wait until the stakes are so high. If you notice something in small form, it's a great idea to go ahead and start having conversations about mental health. Go ahead and start putting those ideas in their mind and checking in with them and getting them resources early to prevent things coming to a head. Also, education. Learn the signs of suicidal intent. Learn some of those things that we've been talking about throughout the presentation. Drill those into your mind, and also do some further research to educate yourself. And lastly, investment. Invest in mental health practices as a regular part of life. As you know, life is happening, and regular therapy sessions are very helpful for emotional regulation. That you don't have to use therapy when things are going bad. Things can be going fine, and processing life is always a good decision. Processing healthily is always a good decision. And that is all for this presentation. Thank you so much for sitting through this. I know this was a heavy topic, but thank you very much. These are all the references. You can go to these articles and check them out. This is where most of the information has come from. So thank you for listening, and I wish you and your adolescents well.